Coronary artery disease, a guide for patients, families, and caregivers. My name is Rebecca Vela. This is my capstone project for nursing for Capella University, NURS FPX4900. This educational presentation is designed to help you understand and better manage your diagnosis of coronary artery disease. In this presentation, we will answer the following questions. What is coronary artery disease? What causes coronary artery disease? What are my risk factors? How is it diagnosed? Is there a cure? What can I do to improve my health? Where can I get more information? Coronary artery disease, otherwise known as CAD, is a buildup of plaque in the heart arteries. Plaque is made of cholesterol and other substances. Cholesterol is a waxy, fat-like substance found in foods and also produced by the liver. Too much circulating cholesterol can build up on artery walls. As blood vessels narrow due to this buildup, blood flow to the heart muscle is limited. When the heart doesn't get enough blood, it can't fully function and may lead to symptoms or even a heart attack. Symptoms are broad and can include chest pain, shortness of breath, dizziness, fatigue, nausea, cold, sweaty skin, or even back, neck, arm, or jaw pain. Just note, if you have any of these symptoms, please call 911 or seek medical care. For some people, the heart attack is the first symptom. The image to the right is a visual example of plaque buildup over time, progressively narrowing the artery until it is completely blocked. CAD happens predictably in people with certain risk factors. The greater the number of risks, the higher the likelihood of CAD. The big three risk factors are high cholesterol, high blood pressure, and smoking. We spoke about high cholesterol on the previous slide. High blood pressure, otherwise known as the silent killer, often does not present with any symptoms. Please refer to the blood pressure categories chart to the right as published by the American Heart Association for specific category numbers. Smoking damages blood vessels, it damages heart muscle, and it also reduces the oxygen levels in the blood. Additional risk factors for CAD include diabetes, obesity, or being overweight, people that have a family history of CAD or heart disease, mom, dad, uncles, cousins. There seems to be a genetic component that is passed down through families. Low physical activity, not enough cardiovascular exercise is another big risk factor for CAD, and excessive alcohol consumption. So let's say I've had an episode of chest pain, or I've got some risk factors and there's some suspicion for CAD. How will my doctor diagnose me? Initially, the doctor will probably order some non-invasive tests like an EKG, an exercise stress test, maybe an echocardiogram, to look and see if there are any abnormalities or any irregularities. An EKG is basically it's a tracing of the electrical conduction system of the heart and can show the doctor if that electrical signal is traveling across the heart muscle normally or if there's something a little different. An exercise stress test looks at the heart tracing. It looks at sometimes what's called a perfusion scan to see how the heart does under the stress of exercise, or they can do a chemical stress test as well if you don't tolerate walking on the treadmill. An echocardiogram is an ultrasound of the heart muscle so that the doctor can look at the pumping function. He can look at the valves and the chambers in the heart and see if anatomically everything looks okay or if there's something suspicious. They might additionally do some lab work and check some things in your blood to see if there's any irregularities there. If any of those things are suspicious for CAD, or a patient is having continued chest pain or shortness of breath or symptoms, and that stress test is not totally normal, they might proceed with what's called an angiogram or a heart cath. An angiogram is kind of like a live x-ray of the blood vessels in the heart that can show the doctor exactly if and where there's any blockage. An angiogram is considered the gold standard in diagnostics of CAD, or in diagnosis of CAD. So you or your loved one has now been diagnosed with coronary artery disease, or CAD. Now we're looking at treatment. What does treatment consist of? Most treatment consists of lifestyle changes or lifestyle modifications. And the goal of those changes is to stop the progression or advancement of the disease and even stimulate regression of CAD. And especially if someone has had a heart attack, these lifestyle modifications and changes can actually help strengthen the heart after having a heart attack or another cardiac event. So things that we can do, we need to follow a heart-healthy diet, and we'll go more into detail on that in a minute. Increased physical activity or cardiovascular exercise. We need to manage our stress, stop using tobacco products, manage our weight, and then we also may be prescribed medications to lower blood pressure and cholesterol, or to prevent another heart attack or even a stroke. A heart-healthy diet is the mainstay of cardiovascular care. When you're following a heart-healthy diet, and these are recommendations from the American Heart Association, you're going to want to eat a wide variety of fruits and vegetables. Think of things that are bright colors, reds, greens, oranges, purples. You want to try to stick to whole grains and products that are made of whole grains. So, bread needs to be whole grain bread, not the white bleached processed white breads. You want to look for whole grain crackers, things of that nature. Proteins need to be from healthy sources, mostly plants such as beans and nuts. For meats, you might have fish, seafood. And if you are eating meat and poultry, you want to make sure that it's lean and unprocessed. You want to stick to low-fat or non-fat dairy. If you do use any oils, you want to use liquid and non-tropical vegetable oils. Again, minimally processed foods, things that you don't know all the ingredients to, or that come in a package with a long list of ingredients. Probably want to stay away from that. You also want to minimize your intake of added sugars. And then you really want to watch the salt. So foods need to be prepared with little or no salt, and make sure and check that sodium content on the packages of prepackaged things that you purchase. Additionally, you want to limit or preferably not have any intake of alcohol. Exercise and physical activity recommendations. The American Heart Association recommends 150 minutes spread over 1 week of moderate intensity aerobic activity. This can be broken down into 30 minutes, 5 days a week, or whatever suits your schedule. And this would be things like walking, swimming, dancing, gardening, things that get your heart going, maybe a little out of breath, but it's doable. Or the alternative would be 75 minutes spread over 1 week of vigorous intensity aerobic activity. And this is going to be, where you're really pushing at things like running, HIIT training, things that are a little harder. Additionally, they recommend muscle strengthening 2 days per week. This could be, hand weights, or the stretchy bands, the resistance bands, but something to actually help strengthen those muscles. And then really any physical activity, get up and move. Even if it's your exercise is done for the day, don't sit in one place. Get up and move. Park your car a little farther towards the back of the parking lot. Take the stairs when you can. Just keep moving, and that'll help keep your cardiovascular system running smoothly. Stress management. Stress management doesn't often get the recognition that it deserves in living a healthy lifestyle. Stress is hard on your cardiovascular system. It can raise your blood pressure, elevate your heart rate. So we need to really, take a moment and recognize when we're stressed, when we're in stressful situations, and try to combat that as best as we can. Some ways of doing that would be, one, to practice gratitude in those moments where, life is frustrating and we feel ourselves getting a little more tense, a little more stress. Being mindful and having a statement, today I'm grateful for, and really focusing on, two or three things that you're really grateful for today, can really make a big impact on those feelings and the things that are happening in your body. Additionally, breathing exercises, 5 deep breaths. Breathe out twice as long as you breathe in can really kind of ground you and help reset that mood. Kind of brings your blood pressure down, bring your heart rate down. It's very, very effective at helping manage stress. And in avoiding stress to begin with, sleep hygiene is very important. Getting a good night's sleep, having a sleep routine, maybe turning screens off an hour before bed, having a routine every night, go to bed at the same time, have a relaxing activity, a book or a crossword puzzle or something calm and relaxing to do for a few minutes before bed. And then positive self-talk. It's not easy, but making it a habit can be really good for stress management. So you're looking at something and it's very stressful and it's anxiety provoking, but giving yourself a pep talk with the words, things like, this might be hard, but I can handle it because, and really talk yourself up. And all of those things will help you better manage your stress, which is better for your heart. In order to improve heart health, we have to quit using nicotine and tobacco products. Smoking cigarettes particularly is really rough on the cardiovascular system and causes a lot of damage to the heart and the arteries all throughout the body. The American Heart Association has a plan to help people with tobacco cessation, and they have a 5-step plan to quit smoking or vaping or chewing tobacco or whichever of those things is the problem. That plan includes the first step, which is to set your quit date. And so you'll make a pledge and mark on the calendar when that quit date will be. The second step is to choose the method that you'll use for quitting, whether it's going to be stopping cold turkey or cutting down on the number of products you use every day until that quit date. The other method would be to only smoke part of each cigarette or use a little bit of what you normally use. And then once you get to your quit date, you would stop completely. Sometimes some people do need some prescription medications to help them quit successfully. So you might want to speak with your doctor and see if there's something that might be of benefit to you. The longer that someone has been smoking, the harder it is to quit. So it's perfectly okay and advisable to speak with your physician to work with your doctor on setting up a solid plan for quitting. So then you're going to make your plan for your quit day and what you're going to do after that. So let's say you quit, but then what? You need to plan some other activities to do instead of smoking or chewing or vaping or whichever the preferred method is. Whether it's going for a walk or playing cards or, reading a book, something that's going to occupy your time. Maybe even want to have some healthy snacks on hand, something that's chewy or crunchy to kind of keep your mouth and your hands busy, popcorn, nuts, fruit, something that's healthy. So you want to have all of these things lined up and in place so that whenever your quit day comes, which is the last step, you quit for good on your quit date, you'll be well prepared to be successful. Step in managing CAD is managing your weight. We should be aiming for a healthy BMI. That's going to be a BMI of 18.5 to 24.9. And ways that you can manage your weight are through healthy eating and increased exercise and activity, both of which, if we're following this heart healthy lifestyle, are already in place. So, weigh yourself every day, see how your clothes are fitting. And if you're not losing as quickly as as you'd like. Maybe speak with your doctor. There may be some other tools in the toolbox that your physician can help you with to try to get that weight down, get the excess body fat off, and that'll really make a big difference in your cardiovascular health. Um, Even modest weight reductions make big differences in blood sugars and blood pressures. It'll help with cholesterol levels and just kind of the overall cardiovascular picture. When that weight is down in the healthy range, it has improvements all throughout the body. Even if we're committed to a heart healthy lifestyle and making the lifestyle changes that we've already discussed, your doctors may still want to prescribe some medications just to get you there a little faster, get your numbers better a little quicker, and to have a little better control over your overall cardiovascular picture. You may be prescribed medications to lower blood pressure, to lower cholesterol, and they may also prescribe medications to help reduce the chance of heart attack or stroke, particularly if you've already had a heart attack. They may start some blood thinners or antiplatelet medications. Additionally, if you've had a heart attack and have had some heart damage, they may prescribe something to help lessen the workload on the heart so that your heart can rest a little and work towards getting healthier. So don't be discouraged if your doctor still prescribes you medications, even if you're doing all the right things. Um, you know, your overall health can be reassessed as often as is needed. And then if those medications are no longer necessary, then, that's a conversation to have with your doctor and see what the parameters are for stopping those medications. So how do we evaluate or how do we measure how well treatment is working? There's several different things that we can look at, different measurements. So once you've been following the lifestyle modifications for a period of time, intermittently at checkups and appointments, we'll look at a few things. One is we'll look at lab work. We'll look at those cholesterol levels. We want to see what's called the LDL coming down, the HDL coming up, and the triglycerides coming down is kind of a typical range of levels that we're looking at and want to see changes in. We also will, check your blood pressure and review logs. Hopefully you're keeping a log at home and checking your blood pressure at home and bring those logs into your appointments. We'll review those logs and look for trends and see how your average blood pressure's been doing. Additionally, we're going to want to know how much activity have you been participating in? Have you been getting 30 minutes 5 days a week or 150 minutes a week? We want to look at those logs and see if there's room for improvement, or if we're doing a good job. Are you having any angina? How are your symptoms? If you've had angina, is it well managed? Does it resolve quickly, or is it progressing? Is it getting worse? Have you had any increase in fatigue or shortness of breath? Or is your fatigue getting better? Or is your shortness of breath getting better? Additionally, we'll want to look at your weight and recalculate your BMI, really at every appointment. Um, and so all of these things collectively will give us a good overall picture of how well the self-managed lifestyle modifications are working or not working, and if there are other interventions that we could add, or things that we could do differently to improve your coronary health. Thank you so much for viewing my presentation on coronary artery disease and its symptoms and its treatment. I truly hope that you gained some tools from this presentation that you can take with you and will be lifelong lessons that you use to improve your overall health for years to come. If you have further questions or there's other information that you're interested in, I have included some additional information on places to get heart health information and tobacco cessation information. So I've included the information for the American Heart Association and for the Centers for Disease Control for their heart disease website, and additionally the CDC's tobacco cessation support information. So for people that need a little help with stopping tobacco. There's some great information on that website. Additionally, there's a toll-free number. It's 1-800-QUIT-NOW. And they're more than happy to help. And I wish you a lifetime of heart health. Thank you.